Oh, add to stream. Oh, okay. Should I start again? I'm so sorry.
Yeah, no problem. Just add yourself to stream.
Should I start again?
Yeah.
Okay.
Just add to the stream.
Yeah, I have done that. I've done that.
Okay.
All right. Okay. Hello. Hi. I'm Pranjul. I'm a part of Belly Baby Mom Collective. And today we are going to be talking about how touch is so important for premature babies and how massage can not only improve a premature baby's health but actually help them thrive. And this talk has been organized by the Belly Baby Mom Collective, a collective that I'm a part of. And today, we are hosting a series of events to talk about premature babies' health. And we are doing a series of talks, a series of interviews with mommies of premature babies. And the main aim is to make those families realize that they are not alone and they are warriors, and we very well support them and we understand their situation. This talk is also supported by Pigeon Arabia, a premier brand which supports moms from maternity to childbirth to childcare, used by families all around the world, developed by experts. So, let's start by asking ourselves a question. Why is touch so important for a little baby? What makes a massage such an important thing for newborns? So if we start asking us this question, I'm sorry. So we need to ask ourselves that why is baby massage so important for a little one in the NICU? What could be the reason? So let's go back to the journey. When a baby is born, when a baby is inside the womb, when a baby is just a fetus inside your womb, and you just discovered that you are expecting. So that is, at around 5 or 6 weeks of gestational age, when you realize that you are pregnant. And at that time, you would be surprised to know at around 7 weeks of gestational age, the fetus inside you has developed the sense of touch. So that fetus at 7 weeks of age can't hear, can't smell, can't taste, can't see, but any touch that is given to that fetus can be felt by the fetus. So that is the power of touch. And as the fetus grows, the little baby inside your womb will continuously touch his or her own self, will continuously touch his or her face, will continuously touch the mother's abdominal walls. So that's how a child gets the idea of the surroundings, the surroundings, the idea of existence. So this is where the journey of touch starts. And when a baby is born premature, many senses won't be developed yet. Often the lungs aren't developed and those babies need support in breathing. Often, of course, they can't see well. They don't sometimes even open their eyes a lot. A lot of sensory, parameters are affected. But one thing that is fully developed and fully there, with your baby is the sense of touch. And this is something which makes a premature baby realize that he or she is cared for, he or she is loved. Now, many times, in fact all the times, when a premature baby is there, the baby is touched in ways that the baby wouldn't like to be touched. For example, heel pricks, the baby's blood parameters need to be monitored. So the baby's blood is taken often, by pricking at the heels. Then something like, ventilator support. Many babies need help in breathing. There are pipes connected, there are monitors connected, there are fully trained nurses feeding your baby. So the baby is constantly being touched, but not in a way that the baby would be happy about, would be comfortable about, or would thrive. And this practice was there since the very beginning. And in the 1970s, they discovered that despite having very good medical care, premature deaths were going on raising. They were not decreasing, and the doctors all around the world were puzzled that even though we are providing the life support that a premature baby needs, why is it not that the babies are thriving? So in the 1970s, they came up with something called Kangaroo Care, and that was the game changer. So they noticed that if your little one is held, bare chested onto your naked chest, and there is enough skin to skin contact, your baby not only survives, the baby thrives. And why does the baby thrive? Because Kangaroo Care results in superb temperature control. The baby's fat reserves are very low. A premature baby's fat reserves are very low. So when the baby is hugging you in skin to skin contact, the baby's temperature, body's temperature stabilizes. Then the baby, is able to breathe easily. And this you can instantly see. The moment the premature baby is held, you will see the breathing becomes more in a rhythm. On top of that, they noticed that the crying, the uncomfortable feeling of the baby is instantly reduced. Babies who have Kangaroo Care, premature babies who are given Kangaroo Care, they cry less, they sleep better, and their immune system really becomes better, because they are exposed to the good bacteria of the parent or the loved one giving the baby Kangaroo Care. So when all these beautiful results were observed, then medical professionals realized that Kangaroo Care can be a real game changer when it comes to premature care, and they started actually asking for volunteers, to come in and give some babies that support. Many times the parents are not able to fully devote themselves to a little baby in the NICU because of various reasons, or because of themselves being unwell. So in that case, they started, and they still ask across the world, volunteers to come in and give hold the premature babies. And you will see that when you lift a premature baby, the baby is uncomfortable, the baby is squirming, the baby might be crying in a low pitched weak voice. But the moment you hug the baby, the breathing stabilizes, the temperature stabilizes, the crying reduces. You will immediately see a satisfied baby hugging you. And the way the most important thing about Kangaroo Care is that when it's skin to skin, the oxytocins are released, and all the good hormones are released in the baby's body as well as in the parent's body. And just release of those good hormones, make sure that the baby is a lot more calmer, a lot more physically better. And babies are able to leave the NICU sooner if they get that Kangaroo Care. Now, sometimes, unfortunately, some premature babies are so weak that you're not even able to hold them. Like, they are attached to so many tubes, so many monitors, that sometimes doctors, they don't allow you to hold the baby in a skin to skin way. And for that, the most important thing to do is just touch the baby. I mean, do nothing fancy. Just a simple touch, just holding the baby's arms, just putting a hand on the baby's legs, or using your cupped hands on the baby's head, or on the baby's buttocks, on the baby's back, on the baby's feet, is good enough to give that baby the security of being held, of being touched, of being loved. Because this is the simplest way of saying I love you to your premature baby. You could be doing the fanciest of things, arranging the best possible medical care, the best possible toys for your newborn, but the effect of your touch is unmatched. And not only for premature babies, even for other normal term babies, touch is an essential thing for them to know that they are loved and they are cared for. And in the process of touching them or hugging them in Kangaroo Care, often, they are able to recognize their care provider's smell also, and they are able to hear the moms or dads speak. They are able to recognize those familiar voices, the familiar smell, the familiar sound, that rhythmic breathing of the parents heartbeat, that makes them instantly comfortable. And if so, a touch goes a long way. And for babies who are really unwell and you're not able to cuddle, so as I told you, just put a cupped hand on their head, on their buttocks, on their back, on their feet. That itself, would make a huge difference. And often, you can even allow your little one to just hold your finger, just grab onto your finger. And that itself, it itself, gives your premature baby that confidence that this person would not, I can touch this person without feeling uncomfortable. Because yes, the nurses are coming in to feed, to check the parameters, to make sure that the blood work is proper. So the nurses and the doctors are doing their thing, but all that is uncomfortable touch. And just to balance that uncomfortable touch, a premature baby really needs a soothing touch. So when we talk about soothing touch, one more thing you can do is hold your baby in something that is called a containment hold or a containment touch. So what is containment hold or touch? Containment hold or touch is like holding the baby, in such a way that you place one hand on the baby's head and the other hand on the baby's legs or the baby's feet. So in a way, you are kind of making a contour, a safe contour around your baby using your hands. And this little, cupping action really helps the baby feel emotionally a lot more secure. All right. So, as I told you, Kangaroo Care, an excellent way of making your premature baby thrive. A simple touch, something as simple as letting your premature just cling onto your finger, or just touching the baby's chest or head or hand, again, is an excellent way. And the third thing that can really help is containment hold. Of course, you would need to speak with your premature baby's healthcare provider on what is allowed, what is not allowed. But mostly doctors around the world, they encourage parents to come in and spend a few minutes with your premature baby, just touching and just being there for the baby. Now, apart from touch, as your baby grows, you can actually start speaking or humming in a very soft voice. You can begin that too. Don't start it immediately, because your premature baby is so fragile that the baby might feel a little overwhelmed by all the sensory stimulation. And anyways, the all the monitoring machines and NICUs aren't the most quiet places. So anyways, there's a sensory overload, but you can always look at the baby's cues and accordingly start humming or singing in a very low voice to soothe the baby, along with touching the baby. And it always makes sense to get your doctors okay and get their inputs, so that we make sure that the baby is comfortable. And the other way is just checking the baby monitor. Sometimes it's amazing, there are observers who see that the moment a premature baby is touched or cuddled, they see that the monitors, they just perform better, which is a superb thing, which means the baby instantly responds to your loving touch. Apart from just touching the baby, one more thing we can do to make your little one thrive is premature baby massage. Now, of course, when we massage a full term baby or a baby who's like, around 1 month of age with umbilical stump fallen off, there are a lot of, you can actually use a lot of strokes, and you can do a lot of gentle exercises with your baby, and your baby would completely be able to communicate whether he or she is liking the massage or not. If your baby is uncomfortable by your strokes, your 1 or 2 month old baby would make sure you are aware of that by crying, by by changing skin color. The baby would be visibly uncomfortable. But often, premature babies parents, they're unsure of, they don't know whether how to touch, how to massage the baby with all the all the tubes attached, and the baby being so fragile, they're nervous, and it's completely understandable, right? So the main thing to remember while massaging a premature baby is that, of course, very strong strokes can hurt the baby, but at the same time, using very gentle, ticklish touch will make the baby equally uncomfortable. So the most important thing to remember is use gentle hand on your baby. The hand, the kind of pressure you would use to maybe massage your own eyes. So that kind of pressure, just imagine touching your own eyes and how gently but firmly you touch it. Use the same pressure and the same confidence while massaging your premature baby. And one of my what my suggestion often to parents of premature babies is that often you use you use stroking action. So if your baby is on your chest, you can always stroke the baby. Stroke the baby in a loving, gentle way, and at the same time, use a firm hand. Make sure it's not ticklish, make sure it's not hurting the baby. So, just stroking the back or maybe the full body, the full backside of your newborn is just a great thing, and you do, and you can often do it with all the helping tubes and the machines attached. The baby doesn't need to be off it to be stroked in that way. And if your baby is lying in a flat position, on the little incubator bed, then if the baby feels comfortable, you can do the same stroking action on the baby's limbs. But of course, you'll have to see, because sometimes the babies have injection pricks, and you can immediately make out that your little one is uncomfortable. So any part that is available to you and you're confident of, that part is a little bruise free, and any kind of treatment hasn't been done on that part, say the legs or the upper arms, you can just stroke your baby. So the very basic form of massage, which can be given to a baby in NICU, would mean just stroking the baby, and you can always do it in downwards direction, because it's just convenient, it's just easy to follow. And many premature babies have been observed to actually enjoy and get calm by that downward stroke, touch. And if your baby is thriving, and you feel confident yourself, you can even do circular motions, clockwise circular motions around the baby's navel, the baby's tummy. But of course, for this you'll have to get the nurses and the doctors permission. And if your doctors are happy with it, it's a very good stroke to improve your little one's digestion, where you just in a clockwise way just stroke the baby's the area around the baby's navel. All right, so that is the very these strokes are the very basic strokes. And many times, I have heard parents complain, especially the fathers complain, that how can I massage my premature baby when my hand is just too big for the baby's body. The baby can actually fit in my hand. The baby is that small. So in that case, what I suggest is just using your one or two fingers to gently, stroke the baby. Stroke the baby's back using your two fingers, or just gently stroke the baby's, arms or the legs, just two or three fingers instead of the whole hand. And and the same thing can be done for the circular motion around the navel also. You can safely use just one or two hands. Make sure, of course, your hands are clean, your hands are sanitized, and just either use your full hand or one or two fingers while doing the strokes. So this kind of massage, or kangaroo care, or touch, or containment hold, would actually stimulate the baby in the right way without overwhelming the baby. And you will always need to start by initially by giving kangaroo care or containment hold or baby massage just for a few minutes, maybe 2 minutes. And slowly, slowly, as the baby gets ready to go home from the NICU, you will see that you will be able to increase that to 5 minutes, 7 minutes. And kangaroo care is something that, many babies, they just like to sleep in that position. So there are so many parents who are able to hold their premature babies all night for several hours in that position, just hugging the baby. And this is one thing that will, in every way possible, tell your baby that the baby is loved, the baby is cared for, and the baby is not alone, because we can imagine how unreal, how frightening the environment of an incubator or an NICU is. And the only way to tell the baby that you are there for them is just by making the baby feel your presence. And the moment your skin touches the baby's skin, trust me, not only for the baby, even in your body, plenty of good hormones are released. And moms who touch their baby regularly, whether it's in the form of cuddles or massage, they are able to breastfeed their babies very well. They are able to their own cortisols reduce. They feel as if they are more in control, which is really important for these warrior families, because they are not even sometimes able to be with their baby that much. They are just outside the NICU waiting for the nurse to give them news. The feeling of being in control is very important. And just stealing those few minutes every day to hold your premature baby is what can actually give the mother a control, a control of being there for her newborn. And those parents who regularly touch their premature baby are sleep better also, because of just all the good hormones being released. Their stress goes down, their sleep is better. The mothers are able to breastfeed more easily, because research shows that touch has a direct correlation with increasing the prolactin levels. And of course, the love hormone oxytocin is released, and all this results in the beautiful bonding that every baby deserves. And all these things about holding the baby, massaging the baby, cuddling the baby doesn't have to end when your baby comes home with you from the NICU. It doesn't need to end there. It can continue till the time your baby is running around not wanting to be hugged. So this is something that should be continued all throughout your baby's the first year, the second year, the third year, till the time your baby allows you to do that. So this was all about touch, positive touch, massage, and kangaroo care for premature babies. And please feel free to contact me or my team at Belly Baby Mom Collective. If you have any further questions, we would be happy to help. Thank you so much. Bye.